Insulin Part 2. Insulin preparation and administration. Insulin is given via a syringe as a subcutaneous injection. Insulin comes in either pre-filled syringes, also known as insulin pens, or in vials where you have to manually draw up insulin into an empty syringe. Before we talk about how to mix insulin, let's review the types of insulin discussed in the last video. Lispro and aspart are rapid-acting insulin, regular insulin is short-acting, and NPH is intermediate-acting. These types of insulin can be mixed safely and given as one injection. For example, the intermediate-acting NPH is often mixed with either short-acting or rapid-acting in one syringe. Because NPH is cloudy in appearance while other types of insulin are clear, the clear insulin should be drawn first to avoid being contaminated by the cloudy insulin. Remember, clear before cloudy. Here is how it should be done. Use an insulin syringe with a needle. Inject air into the cloudy insulin or NPH. Remove the syringe. Use the same syringe and inject air into the clear insulin and draw up the clear insulin. Remove the syringe from the clear insulin and use the same syringe to draw up the cloudy insulin. That way, the clear insulin does not get contaminated by the cloudy insulin. Just a side note, injecting air into a vial first before drawing up creates a vacuum so that the medicine will flow easily into the syringe. So remember, clear before cloudy, which means rapid-acting or short-acting before intermediate-acting. Once mixed, it must be given within 5 to 15 minutes of preparation, otherwise they can bind together and make NPH less effective. So always make sure the meal will be ready in the next 15 minutes before mixing and giving the insulin. As mentioned in the last video, the last type of insulin, the long-acting insulin, cannot be mixed with any other types, and usually are packaged in pre-filled pens. Insulin administration. Insulin is given subcutaneously or into fatty tissue just under the skin. The only type of insulin that can be given intravenously is regular insulin, but we will be focusing on subcutaneous injection in this video. Special syringes with calibration in units per milliliter, such as 100 units in 1 ml or U100, are used for insulin administration. Needle size is 27 to 29 gauge and about 0.5 inch long. Most common sites for sub-Q injection are abdomen, under the arms, on top and outer part of the thighs. Clean with an alcohol swab, pinch skin, and inject at a 45-degree angle. Do not aspirate with sub-Q injection. Do not massage or apply heat on the injected area, which can increase absorption rate. Rotate sites to help prevent lipohypertrophy, which is scar tissue formed in the fat tissue when the same spot is used repeatedly. Here is a quick recap for the NCLEX. Clear before cloudy. Regular insulin, lispro, or aspart is clear and should be drawn first before NPH, which is cloudy. The mixture needs to be given within 5 to 15 minutes, so make sure the meal will be ready by that time. Never mix long-acting insulin. Rotate sites with each injection. No need to aspirate. Do not massage or apply heat at the injection site.